Diabetes is a chronic condition that affects millions of people worldwide, often developing silently over time. Early detection is crucial as untreated diabetes can lead to serious health complications such as heart disease, kidney failure, and nerve damage. In this video, we will give a detailed exploration of the most common indicators of diabetes, highlighting how they manifest and why they occur. Recognizing the early warning signs can help individuals seek timely medical attention, make necessary lifestyle changes, and effectively manage their condition. Number 1. Increased thirst, polydipsia. An unrelenting feeling of thirst is one of the earliest and most noticeable signs of diabetes. This symptom occurs because elevated blood sugar levels pull water from your tissues, leaving your body dehydrated. When your body becomes dehydrated, it signals your brain to drink more water, resulting in a persistent need to hydrate. Unlike normal thirst that arises from physical activity or hot weather, this type of thirst is often relentless and unrelated to your daily activities. Many people may not initially connect this with a health issue and instead attribute it to other factors, potentially delaying diagnosis. Number 2, frequent urination, polyuria. Frequent urination, especially during the night, is another common early sign of diabetes. This happens because the kidneys work harder to filter excess sugar from the bloodstream. When they can't keep up, the surplus sugar is excreted in the urine, along with large amounts of water. This process not only increases the volume of urine, but also the frequency with which you need to relieve yourself. Over time, this can disrupt your sleep and leave you feeling exhausted. Many individuals dismiss this symptom as a minor inconvenience, not realizing that it could signal a serious underlying issue. Number 3, unexplained weight loss. Losing weight unexpectedly can be alarming, particularly if you haven't changed your eating or exercise habits. In diabetes, the body struggles to access glucose from the blood to use as energy. As a result, it begins breaking down fat and muscle tissue for fuel. This rapid loss of fat and muscle can lead to noticeable weight loss, often accompanied by a feeling of weakness. People experiencing this symptom may feel alarmed, but may not associate it with diabetes, particularly if they have not been diagnosed or do not have a family history of the condition. Number 4, extreme fatigue. Chronic fatigue is a hallmark symptom of diabetes and is often misunderstood or overlooked. This tiredness stems from the body's inability to use glucose effectively for energy. Even though you may be eating enough, your cells are essentially starved of fuel. Additionally, other diabetes symptoms, such as frequent urination and dehydration, can compound feelings of exhaustion. You might find it difficult to complete daily tasks, focus on work, or stay active, even after getting a good night's sleep. Many people attribute this fatigue to stress or aging, potentially delaying a proper diagnosis. Number 5, blurred vision. Diabetes can have an immediate impact on your eyesight, often causing blurred vision. High blood sugar levels lead to fluid imbalances in the body, including in the lenses of your eyes. This causes them to swell, altering their shape and making it harder to focus. In some cases, people may notice their prescription for glasses or contact lenses changing more frequently. While blurred vision may improve once blood sugar levels stabilize, prolonged high blood sugar can result in permanent damage to the retina, a condition known as diabetic retinopathy, which can lead to blindness if untreated. Number 6, slow healing wounds. If you notice that minor cuts, scrapes, or sores take longer to heal than usual, it could be an early indicator of diabetes. High blood sugar levels impair circulation, reducing the supply of oxygen and nutrients needed for tissue repair. Additionally, elevated glucose weakens the immune system, making the body less effective at fighting off infections. This can cause wounds to remain open longer, increasing the risk of complications such as ulcers or severe infections. People with diabetes often notice this symptom in areas that experience pressure or friction, such as the feet, making proper foot care essential. Number 7, increased hunger, polyphagia. Feeling constantly hungry, even after eating, is a symptom known as polyphagia. In diabetes, the body struggles to use glucose as energy, either because of insufficient insulin production or insulin resistance. As a result, the brain perceives a lack of energy and signals hunger, prompting you to eat more. Unfortunately, consuming more food doesn't alleviate hunger because the glucose from the food isn't properly utilized. This cycle of eating without satisfaction can lead to frustration, overeating, and weight gain, further complicating blood sugar control. Number 8, tingling or numbness. Tingling, numbness, or pain in the hands and feet, also known as diabetic neuropathy, is a sign of nerve damage caused by prolonged high blood sugar. This symptom typically starts as a mild sensation and becomes more noticeable over time. It is most commonly experienced in the extremities because these areas are more vulnerable to reduced blood flow and nerve dysfunction. Left untreated, diabetic neuropathy can lead to more severe nerve damage, causing significant pain or loss of sensation. This can increase the risk of injuries, infections, or ulcers, particularly in the feet, making early intervention critical. Understanding the warning signs of diabetes is crucial because the condition often develops silently with symptoms that may seem minor or unrelated at first. Over time, these issues can increase the risk of heart attack, stroke, and chronic kidney disease, which may require dialysis or a kidney transplant. Untreated diabetes is a leading cause of blindness due to diabetic retinopathy, a condition where prolonged high glucose damages the blood vessels in the retina. The impact on quality of life cannot be overstated, as untreated diabetes can affect mobility, independence, and life expectancy. If diabetes goes untreated, the consequences can be severe and life-altering. Persistently high blood sugar levels damage blood vessels and organs, leading to complications such as cardiovascular disease, kidney failure, and nerve damage. Over time, these issues can increase the risk of heart attack, stroke, and chronic kidney disease, which may require dialysis or a kidney transplant. Because the potential complications of untreated diabetes are so serious, consulting a medical professional at the earliest sign of symptoms is vital. Early diagnosis allows for timely intervention, which may include dietary changes, increased physical activity, medication, or insulin therapy. A healthcare provider can perform a thorough assessment, such as a blood glucose test or an A1C test, to determine whether you have diabetes or are at risk of developing it. They can also provide personalized recommendations for managing blood sugar levels and preventing complications. Taking the first step by seeking professional medical advice is essential to managing diabetes effectively and avoiding its long-term consequences. Recognizing and addressing the symptoms early not only protects your health, but also empowers you to make lifestyle changes that improve your overall well-being and quality of life. With proper care and management, it is possible to live a healthy, fulfilling life despite a diabetes diagnosis. If you are experiencing any of the symptoms discussed in this video, please take this seriously and contact your doctor immediately for professional medical assessment.